Good evening. Hello, everyone. This is Ask, Ask Dr. Feras. I'm a dentist. I practice in Visalia, California. And this episode come to you, and I want to share with during this episode of some experiences and questions and interaction between me and my patient. So I practice in Icon Dental Implant and Sedation Centers on Main Street in Visalia. You can reach out to us or look up our website or our review. Our website is icondentalimplant.com, and you can see us here on YouTube, Facebook, and you may call us at 559-733-2273. I'm a dental implantologist. I have a Master of Science in Dental Implantology. I also have a diplomat status in the International Congress of Dental Implantology, as well as diplomat in the American Board of Dental Implantology. Also, I earned fellowship in the Academy of General Dentistry. I'm a speaker. I lectures dental implant and smile design and other subjects to dentists locally and internationally. I'm also author, and I have published um, two articles, peer review articles, and one of them a new surgical technique. So without further ado, I hope you invite friends and family, like and subscribe, share, and feel free to comment and ask questions, and I'll be happy to answer the question the best I could. Okay, so the first things I want to discuss today: what's happened if we're gonna have to lose one of the teeth. Let's say you have all of your teeth, you work hard, you take care of your teeth, you floss, you listen to your dentist. Okay, thank you, Ralph. I think I'm having a problem with the sound. Hello, hello, hello. Rechecking the sound here. I apologize if you cannot hear me. I apologize for the sound. I hope you can now hear me. Good evening. I hope you can hear me now. I want to thank Rolf for kind of sharing with me that there's a problem with the sound. I hope you can hear me. If you please make a comment if you can hear me well. Hello. Hello. Good evening, and welcome to this episode of. Can you hear me well? Thank you. Thank you. So I think we are good now. Everyone can hear me. Okay. Great. Thank you, Ralph. Thank you, Mohamed. Welcome to another episode. I apologize for the trouble in the connectivities and also in the microphone. We are live now, so welcome again. Hope you enjoyed this episode of Ask Your Dentist. And I want to share with you some of the interaction, the sincere interaction, an important question related to my patients and their concern. Um, when we talk about different concern regarding to teeth, it's very sensitive and it's important because um, it's there's a lot of uh, concern that the patient usually have, and some of them it's important to share with the dentist. So, and let's start with the first one. Uh, when we let's say you have all of your dentition and you really work hard, you brush your teeth and you floss and you try to make it to your dentist as much as you could. Now you are in a crossroad and one of your teeth is ailing or failing and is terminal, so we have to remove that tooth. The tooth is hopeless. So the question is, when my patient come and we get to this diagnosis, and sometimes the patient come to me already knowing that this tooth is hopeless and they want to have it removed. So always my next question is, okay, you're right. We know that this tooth is need to be removed. The next question is, what we're gonna do after we remove the tooth? What's the option of replacement option for that future missing tooth? So many times my patient not prepared to answer this question, and sometimes they will look at me, "Oh, you are a dentist, you tell me." Uh, but the point is, when I ask this question, is not to have answer, but to get the patient, to get my patient to think about this, especially when they are in pain and they just want that tooth to be removed and they don't want to think about anything else. So in this, for example, if the patient in extreme pain is, they cannot make that decision right then and there. I don't expect them to, and I don't want them actually to rush into making a decision. So if you are in pain, if you are emotional, if you have a lot of concern, you have fear, you apprehensive, we shouldn't make the decision right then and there. I think is you deserve the right to think about this and without pain. And so the goal is usually to get you out of pain. And that could be done in comfortable, and it's sometimes as simple as getting you a prescription. And sometimes we need to open and medicate the tooth, or sometimes, getting that tooth pulled in conjunction with a plan to replace that missing tooth. So if it's one missing tooth, What the option? What's your options? Of course, in my opinion, the only option is to do the optimal treatment modality. So it's the best approach to do this is not going to be a partial, is not going to be a denture. It's going to have to be a dental implant. And I really sincerely believe this is the only option you have. Now, if we cannot get that implant done now, that doesn't mean we're going to choose the wrong option. Now, are the other options should be on the table? I think you are entitled to have that. But I'm very passionate about we have to do the right things. And in my opinion, this is no brainers. We have to go for dental implant. Now, you might not be ready for dental implant. You might you might be emotionally, psychologically, financially not ready. So that's perfectly fine. So we have to delay um, the placement of the implant, but that doesn't mean we're gonna got, for example, cut virgin teeth, healthy teeth to make a fix prosthesis or fix a bridge. I think if you're not ready, we have to get something temporary, but should be temporary, and dental implants should be done at some point. Okay, so what the other alternative? We talk about partial, we talk about fixed bridge, we talk about implant, and the other option is no treatment, and you are entitled to these options. But what the consequences? So a lot of my patients will tell me, "Well, I'll be fine. I have a lot of teeth, so can I just have the tooth removed?" Look, nobody can see that tooth. And my answer is yes, you can go with that choice, but at cost. And I think if you don't replace even one missing tooth, you are on a road to lose more teeth. Then, okay, usually my question will listen, and there is a moment of silence here, and then they will go and say, okay, what kind of cost, what kind of consequences I have to face? Probably more treatment on the other side. You're going to be on a road now to slowly, but with the time, you're going to lose more teeth. Why? Because I always use this simple example. Just because you have a truck with a lot of tires, if one of them blow, it's not okay to keep driving. Now, it's okay to keep driving if your goal is just to get to the mechanic and get your tires fixed. Same thing. This is not a different. In this very simple example, but it makes sense to my patient. And I like to use as much as possible example for my patient to connect dentistry to their just normal life. So yeah, they would say that makes sense. Well, you know, if you heard this before, that it's okay to lose your teeth, even one tooth, it's not your fault. It's the fault even dentists. We used to say that's okay. But I really believe sincerely and passionately that this is the wrong approach. That doesn't mean like I'm gonna always pressure my patient to kind of move toward the implant. Because I have a lot of patients in my office where they lost one tooth or even multiple teeth and they have not gotten implant. So do I remind them? Do I keep them informed? Yes. Do they believe that implant is the best choice? Yes. And I really sincerely too believe that someday they will get their implant once they are ready. Now, there's steps with the communication with your dentist, with us who love to patient, that we can kind of minimize the cost and the consequences of you even having one tooth missing. And the body also can tolerate some abuse, but we don't want to take it to over that threshold where things start to break. So if you now watching and listening to this, and you have even one missing tooth, let's say on your right side or the left side, try to count in the mirror. Do you have more restoration done on the other side after that tooth been extracted or after that tooth gone missing? So it's very easy to notice, even for my patient, that they end up having more problem after their first tooth is gone. All right. So hope this subject helped out motivate you to reach out to your dentist about replacement options. I think it's very important, and even if it's just one tooth, regardless in the position, if it's in your smile or not, I think it's very important. And you, as a my patient, you deserve to have a full mouth, full teeth. Everyone deserves that. Now, I think is I want to talk a little bit about other subjects. Actually, hopefully two more subjects, and one is related to our life nowadays. Okay, so expectation and realities, and I think it's the difference between your your expectation and self experience affect your confidence in your happiness. So when you approach your dentist for a goal, for example, if you're gonna get two implants in your smile, in your front teeth, having two implants placed in your front, in your smile, that doesn't mean it's gonna give you a whole new smile. So make sure what's your expectations and make them clear to your dentist before you kind of approach the treatment, before you kind of say yes and move on with the treatment. So that's, I think, it's very important. We watch a lot of Hollywood smiles, and they are very nice, but that don't try to copy that on you. That doesn't mean that you cannot get a very decent result. But when you just want to have one implant, it's not going to change your whole smile, or even two, or even three. Actually, two implants adjacent to each other, uh, for example, more complicated and more, and is less aesthetic than having just one adjacent to natural teeth. Teeth make implants look good. So, okay, in other things too, um, as a dentist, when my patients say yes, move on with the treatment, it's a privilege to me, and I don't. It's not my right to have you always accept what I tell you. So when you tell me no, I'm fine with that. I'm totally okay, and I'm still make myself available to help you in the next um, in the next need or next goal when you're ready on your timetable and not mine. So it's really privileged. So it does not bother me at all when my patient turn me down. It's again, it's not my right. As long as my patients are informed, as long as we have a conversation, as long as you allow me to have a conversation with you, um, I think that would be great. And it's fine and it's perfectly acceptable to say no to your dentist. Please also tell your dentist what you think, and we have to have a conversation, a sincere one, hopefully sincere one, and where you can uh, be able to share your frustration, your previous experience. Because when you tell me about your previous experience, I'm not gonna go in to criticize that experience or criticize the previous dentist. The goal is to learn from it, because learning is good and it's gonna make me be in be positioned uh, in a better place, so I can help you better and deliver to you better. Not because I'm smarter um, or greater or whatever you see me, but I want to take the time so I can deliver better for you because I communicate better. So, and when you say yes, and I think that's a great moment, take a lot of courage from you to say yes to your dentist, move on, and I trust you. Make sure that you really trust your dentist. I mean, and you give him a chance, because it's not an easy thing to dentist to take you from A to B, and sometimes we're gonna get to close to B, or maybe gonna deliver beyond and over B, but it's not always. So when my patient asks me like, "What's kind of guarantee? What's kind of things that you can get me?" This is when I say, like, the only promise I give you is to do the best I could for you. And with that, honesty and peace and love to you all who watched this. I appreciate it. Hope you enjoyed this episode. Please tune up for more episodes and have a wonderful evening. Give us a call. If you want a free consultation, give us a call. If you're missing a tooth, 559-733-2273. Share and like. See you soon. Bye.